So it's my pleasure to introduce Wendell Potter and to say that we can only imagine what it would mean to have businesses pushing for single payer. We think it's in their interest, but what do they think? And how do we get inside the minds of the business community? Wendell's the person to ask. Wendell's the author of Deadly Spin. He was the public relations chief for two major healthcare insurance companies before he walked out and became a leading advocate for Medicare for all. He's been engaging businesses in the cause of single payer ever since then, while fighting against Medicare privatization. And you can learn more about Wendell by going to Wikipedia or to www.wendellpotterconsulting.com. And you can also read his newsletter, Wendell Potter Now, on substack.com. So Wendell, the floor is yours.
Hey, thanks so much. It's good to see you all. Appreciate your giving up your some of your Tuesday evening. Because of our delay, I'll cut my remarks so that we'll have more time to have a conversation. And looking forward to that, working with my compatriot Jim Kahn in a few minutes. I thought I would start by telling a couple of stories that give you some insights into what caused me to begin to wake up. I was in a leadership meeting at Cigna in the early 2000s when a new vice president that the company had hired was presenting for all of us to know more about what was coming down the pike. It was Cigna's so-called consumerism strategy. And just about every other big insurance company at that time was on board with a consumerism strategy. We were about to launch the first of our so-called consumer-driven health plans, which, as you all know, was a pseudonym for high-deductible health plans. This newly hired vice president was trying to make a compelling case, trying to persuade us all that these plans would be great for everybody. People would have the tools they needed to be prudent shoppers of healthcare. But there were a lot of questions. He was just peppered with questions about how this would really work, how it would benefit families and individuals. And he eventually just grew impatient and said, look, you're just going to have to drink the Kool-Aid. That shut down the questions. And it was abundantly clear that we were going to have to be signing on to be soldiers in the effort to get every last American as quickly as possible into a high deductible plan. Not only were we expected to drink the Kool-Aid, we were also expected to serve it exclusively to our employer customers. And we, of course, had to make it seem like it tasted great and to lace it with the kinds of ingredients that would make employers both stupid and gullible. And my job was to aid and abet that campaign by talking up this new kind of insurance to the media and eventually disseminating bogus research to show that consumer-driven health plans were wildly popular and were serving employers and their families and saving them tons of money. And of course, we were wildly successful with those campaigns. The media drank it, politicians drank the Kool-Aid, and of course, we got corporate CEOs and CFOs and HR people to drink up as well. Today, as you know, most Americans with private insurance are in a high deductible plan, and they're finding out when they get sick what that really means to them. You've undoubtedly seen stories that have been appearing in the media in recent months about the consequences, about how so many people with insurance can't use it, and they are functionally uninsured. They are paying premiums, their employers are paying premiums month in and month out. But increasingly, people are walking away from the pharmacy counter, not going to the doctor when they should. Because of high deductibles. They just don't have enough money to cover their deductibles. In many cases, when they absolutely have to go to the hospital or have some expensive medication, they wind up deep in debt, and in too many cases turning to and usually in efforts that are not successful to GoFundMe to raise money from strangers or file for bankruptcy. And we really have reached a crisis situation just because of that campaign that began back in the early 2000s. We were expected to tell people that Americans needed to have more skin in the game. And that was part of the Kool-Aid, and it worked wonders. We got politicians and employers to buy into that notion. And so that's where we are today. Soon after that meeting, and by the way, that was the beginning of, as Hank said, me waking up. But I stayed there for a while. Not long after that, I was in yet another and smaller leadership meeting, this time with the CEO, Ed Hanway, at the time. One of my colleagues asked Ed at that meeting what kept him up at night. What did he worry about? And he replied with one word: disintermediation. And of course, as you probably know, that means cutting out the middleman. He went on to say that he was worried that someday employers would begin to wake up themselves and question insurance companies' value proposition as middlemen. In other words, they would begin to realize that the Kool-Aid that had been served all these years had gotten awfully damn expensive and was making their workers sick and poor. You would think that 2 decades later, that employers would be coming out of their days and demanding disintermediation. Instead, they seem to be unaware that they are Stockholm syndrome victims and are unwilling to even try to escape. And that's one of the things that we're up against. Soon after that leadership meeting, I began to really question what I was doing for a living. And it ultimately dawned on me that what I was doing was the exact opposite of what I tried to do in my first career. I was a newspaper reporter, and I always tried to be honest and straightforward and never to knowingly mislead anyone. But of course, what I was having to do now was exactly that, was to mislead people, to get them to believe things that just simply were not true in order to make sure that we made the profits that Wall Street was expecting every 3 months. So this goes a long way toward explaining why the single payer movement has struggled to attract business leaders. But there are also other factors at play. One is just a general distrust among a lot of the business community of government and a loathing of taxes and regulations. And consequently, they're easily persuaded that single payer would represent a huge tax increase for them, because part of the propaganda campaign is to get them to think that there would be premiums and taxes, or to obscure the truth that there would be no more premiums. But that has been something that has been a stumbling block as well too. And here too, they are victims of a decades-long effort funded and led behind the scenes by corporate executives and by flacks like I used to be. And many of them drank that Kool-Aid as well too, probably most of them, to be honest. And they're convinced that the private sector can do anything better than the government. They'll say, just look at the DMV. Another factor is that they don't want to get publicly involved in political debates and taking sides in a big policy debate for fear of potentially alienating some of their customers, if not a lot of their customers. So there's that concern. It's a real concern. They might agree with us, but at the end of the day, they decide they just don't want to take the risk. It's too potentially costly for them in terms of business. Another factor is that they just don't have the facts, or they don't believe the facts. They're humans too, and they're just as susceptible to corporate and political propaganda as the rest of us. And that propaganda makes them fearful of change, which of course is the intent. They've been told by people that they think are straight shooters that have to pay more in taxes, like I said, and that they and their families and workers would be getting substandard care under a single payer healthcare system. And then there's this. Single payer advocates, for the most part, are not business people, and they don't know how to go about earning the respect of business people and frankly, how to communicate effectively with them. All too often, we lead with something like healthcare is a human right. That's fine to use for the converted, but messages like that, unfortunately, don't work with that crowd or some other crowds as well, too. So what are we going to do? Are we going to give up? I don't think so. Are we going to try to serve our own Kool-Aid? I don't think that's going to work either. I'm reminded of one of Stephen Covey's 7 habits of highly effective people. Seek first to understand. We have to accept that we have to learn more about what it's like to run a business and how much drinking that Kool-Aid is costing them. I'm glad that Jim Kahn is here with us tonight, because he and I have talked a lot about this, and Jim has led some important research in this area that I trust he'll be able to share some about later on. We've got to realize that even if we get our messaging right, we might not make a sale the very first time. We've got to keep at it, and in a kind and understanding way. We can't be shrill. We can't be righteous or self-righteous when we're talking to folks. What we want to do is to get them to some kind of yes. We might not get them to agree to march with us on Sacramento or Washington, but they might be able to get them to do something. We might be able, for example, to put some kind of a carefully worded statement in their window, their shop window, the store window, that expresses their support for universal health care, maybe or maybe not single payer health care, but something that is a step along the way to getting them engaged in some way. Here in Philadelphia, in my neighborhood, I can walk around and see a number of coffee shops and other stores that have Black Lives Matter posters in the window. Those are folks you might want to begin to get to know. And if they are willing to do that or take a stand on in some other public way, that might present an opportunity to begin having a conversation with the owners of those stores. The store owners could be turning to be good prospects for us. Get to know them and get them to like and respect you, to understand where you're coming from. But again, for you to begin to understand more about their businesses, and if they offer insurance, how much it's costing them. I might note here that most small businesses these days, as you probably know, can't even afford to offer insurance. In fact, over the years, because of the year after year after year increase in premiums, more and more small businesses, at least those with 50 workers or less, are not offering insurance. They don't have to by law, and most don't. Only about a third of employers of that size actually offer benefits. That can be both a plus and a minus. They need to be persuaded that that puts them at a disadvantage when it comes to hiring and retaining employees. They just can't compete for talent like big companies do that can offer richer benefits. And I would say probably the greatest chance of getting business leaders engaged would be to start with owners and leaders of small to mid-sized businesses. They feel more of the pain, quite frankly, than large employers do. It's more visible on their bottom line if they offer coverage. And I know that they all struggle, certainly in a tight labor market, to attract and keep employees. As you know, I lead an organization called Business Leaders for Healthcare Transformation. We've got several thousand members across the country, and many of them are in California. And I'm hoping that some of those ultimately can be persuaded to go public with their support for single-payer healthcare. But it will take time. And I have to admit that I haven't got it all figured out yet by any means, not by a long shot. And part of the reason is that I haven't yet been able to focus as much time and attention on building up that organization as I'd like. But I assure you that it is a priority, and I'm going to be devoting more attention to building that organization up to be influential and impactful in California, certainly in Sacramento and in Washington and other places. I want to establish, my goal is to establish state chapters of the business group. And we really already have one in California, one that was started a few years ago by folks who were pulling business people into the single payer movement. We've absorbed them into our organization. But one of the things I might want to say is that we need, even if we can't attract hundreds of thousands of business leaders to be supportive or to sign on as members of our group, our nonprofit, we need to create the perception that we are impactful and influential. And coming out of corporate PR, I know that that can be done. You can pull that off. And what you need to do, of course, is to have as many people as you can get who sign on as members. Our organization, by the way, is not a dues-paying organization. We get financial support from folks who support our work, but we don't ask our members at this point to chip in. But I hope that we'll get there, and I hope that we'll be able to persuade more business people that our work is important for them. And I think one of the things that we will have to do is explain more fully to them what's in it for them. And that has to be also part of what we're doing here. Not to be saying that this is going to be good for the state and good for the economy, good for poor people. All that is true, of course, and middle class people, but good for them as well, too. And I think this can be done. It will take more resources than we currently have, financial resources, to really build this up and create that perception. But I think it can be done. And I assure you that it is going to be a priority for me, particularly in California, because I'm pretty confident, and I'll learn from you all, but I would be surprised if there will not be a significant push next year in the legislature there to try to move forward once again with reform. Last year was, well, I guess earlier this year, was in touch with Assemblyman Ash Kalra and wrote a letter of support for the single payer bill that he was sponsoring to the House Appropriations Committee. And those are the kinds of things that I think we can get business people to do. We just need to have a few of them who would be willing to present testimony, to present the business point of view, and to help policymakers understand the pain that employers are suffering. Even the big ones, I don't want to discount them. About a year or so ago, the Purchaser Business Group on Health, which is based there in California and in San Francisco, released a survey of the business leaders of the member companies of that organization, which have the biggest names in the country, in the world. APCO, Apple, and Salesforce, and Microsoft, and all the big companies that are based on the West Coast are members. And that survey showed that 80% of those CEOs said that the cost of health insurance would become unsustainable for them over the next 5 to 10 years. So I think that presents an opportunity. We ought to get to know the folks at that organization and others. I don't think that we should hold our breath and expect them to embrace single payer right off the bat. I think there'd be reasons why they will not be able to do that. But I think having a dialogue with them and with other business groups, we will have opposition, and it will be well-funded opposition. You will see, as you have in the past, that the U.S. Chamber of Commerce and the California Chamber of Commerce will come out against us, and they do because they get paid to do that. Insurance companies pay them a lot of money to carry water for them. And another organization that purports to represent small businesses, the National Federation of Independent Business, you'll often see their logos in shop windows. They're an ideological outfit that has long worked with insurance companies. In my old job, I used to work with the NFIB quite often in Washington to push back against legislation we didn't like. So know that they will probably be an opponent. So we've got to have an organization that is their counterweight, that is a counter to what we will hear from those organizations that will try to persuade the public and lawmakers that they truly represent businesses. They really do not. I would love to work with you all on building up my organization, the organization that I lead, to make it really viable in California, to find leaders in California to take up this work and join the effort to get a single payer system in California if it's at all possible. I'm not saying that we give up on Washington, but I think we need to consider both paths through the states and at the federal level. I spend a lot of time in Washington and often wear the hat of business leaders for healthcare transformation when I'm in meetings, and we can do that in Sacramento as well too. With that, I'll just close with this, saying that I think that we can get to the point that business leaders will begin to question the value proposition of the health insurance business. Just today, I saw something that annoyed me a great deal, and I'm going to be writing about it. It was in Politico, and it was the headline was "Health Insurance Prices Set for Takeoff." You may have been seeing some of those headlines that there's the expectation that premiums will increase 8.5% or whatever the number is. They vary depending on who's doing the research, but that is a number that's being batted around quite a bit. And this article quoted some survey or something that came out of Willis Towers Watson, which is a large benefits consulting firm. And it says, there was this year, employers may again ask their workers to pay up, given the softening economy and recent health trend surveys. Willis Towers Watson, an insurance advisory firm, found that 3/4 of health insurers believe their customers' bad habits and overuse of the medical system are driving up costs. Well, of course, insurance companies will say that. That's the only way that they attack costs, and that is to make it more and more difficult for people who have insurance to actually use it. And they'll point the finger of blame away from them whenever they can. And this is just a prelude to what we're going to see before. They'll be resurrecting the campaign that I was a part of to get people to think that Americans once again need to put more skin in the game. So no, that's coming down the pike. Now I'm indeed going to turn it over to Jim, and let's have a conversation.
Thank you very much, Wendell. Really a great review of the centrality of this issue, the reasons that business has been reluctant to dive in, and the necessity of bringing them in. And I was struck by the statement that you mentioned from some of the respondents to the Business Group on Health survey about the unsustainability of healthcare costs in the next 5 years or so. And it just got me thinking about what are the tipping points, because I really do think that there's tremendous sympathy in a substantial portion of the business community for a real comprehensive reform along the lines of single payer. That is to say, individual business owners, maybe small businesses, but even some of the CEOs and other executives in big businesses, are they really aware of what their competitors around the world are doing and how much an easier time they have of it? But for a variety of reasons, as you pointed out, misinformation. I would say a sort of collegiality with the insurance business community, for a variety of reasons. They're not, laying down the line in the sand and saying it's time for change. So the question is, what are the critical issues in the tipping point, the one that will tip the business community into being vocal and being activist and being willing to say, even against the disapproval of their insurance business colleagues, this system has to change? What's the tipping point?
I've wondered that myself and wrestled with that, and I wish I could be definitive in a response. I've said for many years now, our healthcare system, I think we all have, is not sustainable. It's too expensive. It keeps going up. And I know we've all had the belief that it's going to get so bad, it's just going to implode. And I think it possibly will. I don't think that we want to wait for that implosion. But I think, once again, we need to create that. We need to hasten that, or create the tipping point, create the perception that the tipping point has already arrived. I don't think we can try to focus on getting a few well-known business leaders or leaders of large companies to step in and join our team and speak out. That's going to be a challenge. I've tried, and it's so far without success. But I think, once again, I go back to creating the perception, creating an organization that has respect and visibility. And business people will begin to see that. We need to work in the media to create that perception and find, as I said, we don't need a huge number of them. It'd be wonderful when we do, but start with whatever we can get and find a few business leaders who are articulate, who are willing to get engaged in this. And then we can help through PR to raise their voices, to get their names in the media. So really, I think it is a PR campaign that we can create that, once again, creates a perception, and then it will become more acceptable for other business leaders to get on the bandwagon.
Great. We need to get it started and then picks up steam. I am now charged with bringing you questions from our audience, which is, by the way, up to 44, despite the email problems. We've got the login problems. We've got a good group. The first question is from Steve Vernon, is about not-for-profit businesses who are delivering healthcare, who are enmeshed with the current system, a system where profit is a big issue, but these are not-for-profits. He says they usually form large self-advocacy groups to promote their particular area of healthcare and often wield significant political power. For example, in mental health in California, there are agencies that may exceed $100 million in revenue. And along with smaller agencies, develop advocacy groups for their services. Can you say a few words as to how to work with these not-for-profit agencies and organizations to help them see beyond the lucrative collaborative status quo? Nice phrase, Steve. Lucrative collaborative status quo, and to really focus on healthcare deliveries. And Hank notes that this is in part organizations like FQHCs, federally qualified health centers. So your thoughts on that?
Yeah, and many of them might feel that it's just not politically possible for them to speak up. Some will. I would love to see more people who are involved with federally qualified health centers be involved in this effort. But I think there could be some concern on their part about losing some funding or having a perception of political activism that wouldn't serve their interest. That said, I think there are nonprofits. We shouldn't overlook them because they are employers as well too. We shouldn't just think that we're talking about for-profit businesses all the time. As some of you may know, I also lead a coalition of groups that is focused on one aspect of the problems that we have that's associated with these high deductible plans, and that is high deductibles. And I've pulled together a coalition of organizations, most of them are nonprofits, that are engaged in this with some pretty important names. And some businesses are part of that too. So that coalition is a bit unique in that it's not just your run-of-the-mill advocacy organization, comprising nonprofits, but actually has some businesses involved as well too. And that is something else to consider. How can we work to build a coalition of organizations? Maybe the business group that I've mentioned that I lead can be a part of an effort to build such a coalition. We saw with the was AB 1400 that Assemblyman Kalra was leading, that the chamber came out and trotted out its coalition of 100 or so organizations that were against the bill. And that got reported. We need to play the same game.
Next question goes to the issue of another important ally in this work, unions. Isn't it critical for us to engage with unions? And what's the role of doing that in the pursuit of support from the business community?
I think it's very important. I think there are barriers that we come up against that exist because in many cases union leaders see what they do in terms of negotiating health benefits as a big reason why they exist. And I think are concerned that under a single payer system, that would not be such, obviously it wouldn't be a needed function as it is right now. They also are, in many cases, very tight with insurance companies. They have become strange bedfellows with insurance companies and are resisting change to a certain extent. Not all of them. Obviously, we know some unions and union leaders that are very much engaged in this fight, but a lot of them are just conflicted. They see this as a threat to them and why they exist and what they do for their membership.
Right. Thank you. The next question has to do with how to approach business owners. The questioner, who I think is anonymous, says here it's most effective to ask questions and listen, such as, are your health insurance costs becoming unsustainable? If you can't afford to provide health insurance, has it limited your ability to hire experienced or competent people? And these are actually very much like the questions that we asked recently in a case study of about 10 small businesses, mostly small, actually a couple of large businesses as well. We asked those questions, and in brief, what we found was that all of these issues came up to varying degrees. Some companies mentioned that it takes them a lot longer. This was before the tight labor market. It takes them a lot longer to find employees because they can't afford to provide insurance. Other companies are in a different situation. They said, look, a lot of people are on Medicaid in our state, which is pretty generous, and once they work for us, they're not eager to get off of Medicaid, so that's just not an issue for hiring. So it varies. It's kind of all over the place. But what do you think, Wendell? What are the right questions to strike up a conversation with local businesses if you're a single payer advocate and want to start to get to check in with those businesses?
Well, I think I want to say that research is really important, and it was an attempt to do something that I've not seen anybody else do, any other researchers do. So thanks, Jim, for leading that. And I think we did learn from that, and that is part of the effort to understand them, understand what they're facing, and to be told that exactly what you said. A lot of the people who work for these companies earn so little that they qualify for Medicaid. So there is that. I think you look for those that are offering benefits and try to have a conversation with them about how much their premiums have increased over time. How do they go about budgeting for that? Often it's extraordinarily unpredictable. You never know necessarily when you're going to be hit with a double-digit rate increase. Some find some that have actually been purged by insurance companies, and that is something that happens all the time. When a small business in particular becomes unprofitable for an insurance company, the insurance company will jack up the rates considerably, leaving the employer of the business really no alternative except to see if they might be able to get a better deal somewhere else. Often and usually they can't, or just accept it or get out of offering benefits. I think it is. I think it is just beginning a conversation to see if you can get them to talk about what has happened historically, maybe looking over a 10-year period. How much have your premiums gone up over that period of time? How much have you had to shift the cost of both the premiums and out-of-pockets to your workers? What do you think this is sustainable or not? And I suspect they would have to acknowledge that no, looking at history, there's not. What's the reason to think that next year or 5 years from now things are going to get magically better?
Wendell, I just had an idea.
Yeah.
As you're running through these issues that you're suggesting people talk about with businesses, and I think about the study we just did with your guidance and assistance, maybe we should be creating a working list of questions that PNHP members and others can use as they go to talk with businesses. Let's make that a little task. I don't think it would be a lot of work. We've already got a starting set of questions, and that could be useful for people.
I think that's a very good idea. Very good idea.
The next question comes from Hank Abrams. Would businesses find comparative cost data, what they're spending currently versus what they'd spend under single payer, helpful and persuasive? Now, I'll just add to Hank's question that people who run businesses and intend to have them be a going concern need to be pretty good with numbers. They need to compare their costs to their revenues. So I think in terms of being a high numeracy audience where they're interested in those numbers, I think they're good candidates. What do you think, Wendell?
I think that's right. I'll go back to what you said before. Having questions like that can lead them to acknowledge that where they are right now is too expensive for them and that it's not sustainable. So the questions should be designed to get them to that point of acknowledging and understanding that. I think it's important to do that, and going back to developing relationships with these folks, as I said, they often will be skeptical of facts and figures that come from our side. So we need to try to figure out how can we get information, some data that is from sources other than us. But on the other hand, we need to use what we can to show them, know that there could be pushback, know that there could be there could be some questions about the reliability of our numbers. But I think it's important to have that and to help individually, one-on-one, talk with folks. I might say too, you don't expect to get everybody, but as I said before, get what you can. And there could be some ways of trying to identify some so-called low-hanging fruit.
Great. This question now is from Ellen Carroll. And she asked, the questions are flying in, so I have to scroll up. Asking the question, are there any businesses that have come out publicly for single payer, and how strongly, and are there any that are trumpeting their support is, and I would add, is MCS an example of that? Are there others that are more quietly coming out, maybe not trumpeting it? I also mentioned Penzi's Spices, which is a Midwestern company, has been extraordinarily forthcoming on a variety of political issues, and very much in the same political vein as those of us supporting single payer. I don't remember if come out specifically for single payer, but do you know some companies to mention?
I do. Go to our website for the business group. Go to blhct.org and scroll down, and you'll see the names of several companies across the country that have signed on to support single payer healthcare. Might be worth noting at this point too that we started out in life as Business for Medicare for All. We chose to change the name for a couple of reasons. One, we were told that the IRS probably would balk at giving us our own IRS designation, which is important. It's really essential because it contained the name of active legislation before Congress. And also, when Bernie Sanders' campaign came to an end, the wind just, was no longer at our back. So we decided to change our name to be able to have a greater assurance that we could get our IRS 501c3 designation and to kind of broaden the appeal. We still support, even with the name change, single payer healthcare, but we also want to see if we can, by having that name, get more people, the new name, engaged in a conversation that we can lead them to embrace single payer healthcare. But do look at the list. You'll see some, and I think there's some in California that are on that list. We need to build from that. And there are a couple who've been willing to be vocal. They're business people who are busy running businesses, so they are often, for reasons I noted earlier, a bit hesitant or just don't have the time to really step up. But on the other hand, we haven't had that many opportunities to really press them into service. If in California next year there's another single payer bill, we need to have a few business people who are ready to step up, and I think we can cultivate that.
Great. I'm going to shift a little bit. This actually combines questions from a couple of people. A couple of people have noted the recent attention to changes in Medicare. So not business-based insurance, but instead both the Medicare Advantage side, which of course is the private insurance plans, which is growing, including a recent discussion in New York of directly without choice enrolling new retirees into Medicare Advantage. This is of course greatly advantageous for the private health plans delivering Medicare, because guess what? People who are working and about to retire are healthier than people who are not working. That's called the healthy worker effect, and that means they're less expensive. So it's great to get them into Medicare Advantage. And in addition, on the traditional side of Medicare, the Trump administration started an initiative which is being continued in very emphatically by the Biden administration to privatize the traditional part of Medicare through the establishment of direct contracting entities and what's now called ACO REACH, which is direct contracting entities by another name. And so there's quite a bit of disappointment with the Biden administration for allowing and indeed fostering privatization. What can we do to address that, and how does that relate to the pursuit of business support for single payer?
Well, I think that I couldn't agree with you more. It's dismaying that the Biden administration is continuing that part of what was referred to previously as direct contracting through the ACO REACH effort. I work with members of Congress, and so has PNHP. And hats off to PNHP National for really making this a thing and drawing attention to it. That would not have happened had it not been for PNHP's involvement, in my view, and a few other advocates who work with PNHP and separately. You write letters to the Secretary of Health and Human Services, who's a Californian. Make sure that you are somehow figuring out how to reach him and make your point known. But on the other hand, I don't want to raise any real hopes that you can persuade the current leadership of CMS to pull back on this unless there is more of an outcry than what we're seeing so far. We do need to get more members of Congress to rally behind us and work on this. Some are, as you know, and I'm working with some members of Congress, including not specifically on this issue, but Congressman Ro Khanna and Congressman Mark Pocan from Wisconsin have introduced a bill that would prohibit insurers from even using the name Medicare as they market these plans. And as I've said, and was quoted in a news release that they put out, that these plans are neither Medicare nor Advantage for most people. But you need to, just keep at it, trying to get more champions in Congress. Katie Porter, God bless her, has been a real leader in this effort. I've worked with her and her team on legislation that addresses the Medicare Advantage program. Pramila Jayapal and many others, Jan Schakowsky, Chicago, they're there. You just have to put in the effort to go find them and communicate with them and get them to act. That takes work, and it takes some connections, and takes time. And Jim, my little organization. I don't have a big one, but we do what we can.
Yeah, well, Wendell, you and your organization have been very high profile recently, including appearing on Democracy Now! And Jon Stewart. So thank you for being very visible and very determined. It's been a real boost for the movement to see you out there. I
might say there, that is an example of creating an impression or creating the perception of something that is bigger than it currently is. I have a very small operation, but I'm able to get quoted and use the names of those organizations. And yeah, I've got a platform, I've got some name recognition and some connections, but I think there's a perception that the Center for Health and Democracy and Business Leaders for Healthcare Transformation are bigger than they really are. Perception is reality.
We've learned that in the past few years, I'm afraid.
Yeah.
By the way, I get encouraged regularly with notes to Health Justice Monitor, which of course I edit, to stop saying Medicare Advantage and just instead report it as Medicare Disadvantage, taken under advisement. The next question is also not specific to businesses, but of course you are free to put a business spin on this. Should we be aiming for a national Medicare for all approach or a state-by-state approach, catch as catch can, build up from individual states? Do you have an opinion? And many people in the single payer movement do have an opinion one way or the other.
I know.
Personally, I'm agnostic. Are you agnostic, or are you a believer in one approach or the other?
It's both. You've got to work at both. You can't give up on Washington, nor should you give up on Sacramento. I don't know what path we're going to take to get to single payer. I know we can always look to Canada, but that was more than half a century ago, and they pulled it off province by province. Maybe we could do the same thing. We have obstacles that the Canadians didn't have at that time. So it is hard. Often people will point out at the failure of the folks in Vermont to move forward with their single payer plan, even though the governor was behind the legislation and signed legislation that was passed by the legislature to create a single payer system. It fell apart for various reasons, not because of the merits of single payer, in my view, but because of political issues and some missteps on the part of the administration and even advocates. But Vermont probably was not a good place to start. It's a tiny state. Some of the healthcare facilities that serve a lot of Vermonters are not even in Vermont. So that was a problem, but it is something that we need to know and acknowledge and try to help people understand that was there are various reasons why that failed, not because of the merits of single payer, but for other reasons. I don't think we should. I know exactly what you're saying. I know that there are people in the movement who are disdainful of state efforts and others who are working ardently to try to move forward at the state level and not focus so much on the federal level. I think we got to do both.
Thank you. Are you familiar with the small business majority run by John Arensmeyer? Could you talk about them and what do you think their role is?
I know John, and I know that the organization from back in 2009 and 2010, when I was spending a lot of time in Washington and testified before Congress. John did as well from time to time. They have not embraced single payer healthcare. I've gotten reconnected with them. They did play an important role. So it goes to show you that an organization that represents businesses like that can have an impact. They did. And again, once again, it was more perception than reality. Although it is a real organization with a substantial staff. John is actually relocated from California to Washington, I think, to be there to have more of an impact for his organization in Washington. But they also have a presence in some of the states as well. I know Colorado, for example, and they played a role in the debate in Colorado last year on the public option legislation. I reached out to them, and they are part of my coalition to address out-of-pocket costs. So, that's a step in the right direction. It may be a step or too much to, at this point, suggest that they would be embracing single payer anytime soon. But once again, I'm getting to know them again and work with them and not giving up on them. I will say too, I'm going to be in San Diego the first few days of December. There's a conference of the American Sustainable Business Network. And it is an organization that recently, it's the merger of a couple of organizations that I've worked with over time. One was called the Social Venture Network. The other was the American Sustainable Business Council. They've merged. They've got a pretty substantial team. These are companies that include Patagonia, Ben & Jerry's, a number of other well-known companies, well-known brands. They're convening. Their emphasis or their interest in the past have not included healthcare like you wish they would, but I'm working with them to get that changed. That's why I'm going out there and hopefully talk to some business leaders about the work that we're doing through our organizations and see if we can make some converts out there and get them to understand they need to get involved and engaged on healthcare just as much as they are, many of them, on the environment. A lot of them, they picked these issues that they're all in on that are, in their view, more politically acceptable. We've got to make healthcare compelling for them. I think that's a good place to prospect, by the way, in California and elsewhere, that organization. So come on down to San Diego and help me out.
Absolutely. I'm booking my flight. I'm going to embellish on the next question. I noticed when I was talking to local businesses here in Berkeley, pretty progressive town, I've heard. Talking with businesses that to invite them to participate in a meeting that you were coming to California to convene, Wendell.
Yeah.
And some of the local businesses basically said to me, love what you're doing, Jim. Love what Wendell's doing. Of course, we support single payer. No question. I mean, again, this is Berkeley. We'd love to participate. And by the way, they asked, what's going on with legislation? And I had to say at that moment, nothing at the moment. The AB 1400 was allowed to die a peaceful death overnight because it didn't have the votes.
Right.
And I think that was the right decision. But I could see that these businesses these business owners who are busy running businesses, trying to make a profit, they were not going to, peel off from their day-to-day responsibilities. They were having lots of challenges hiring people. This was when the real worker shortage as the pandemic was kind of winding down, the economy was picking up. And so the question is, what's the role of A, legislation, and B, big B, ballot measures in convincing businesses that now is the time to carve out time from what you do day to day to work on this issue? What's the role of the active campaign like a ballot measure?
I think it's essential, to be honest with you, that there be some active legislation. It's hard to get people motivated and willing to do something if there's nothing on the near horizon that they can actually get involved in, and that there's going to be some real debate about. I think Dan Geiger and Eric's have told us that was a problem to get people really engaged and motivated, because there was the absence at that time of any real legislation. And by the time that Ash's bill was before the legislature, that organization was not really active. So that's a shame. But it just points out that it is important to try to have legislation that you can get people excited about, interested in, and mobilized to support. Ballot initiatives, probably the same thing. I'm always wary, to be honest with you, though, about ballot measures as a path towards single payer. It is the industry and its allies will dump so much money to mislead folks that it's hard to get a ballot measure approved because of all the misleading ads that people are subjected to. You may remember there in California a few years ago, not too long after the ACA was passed, there was an effort, a ballot initiative that would give the insurance commissioner more authority in reviewing rate increases from insurance companies, and give the commissioner the authority to reject unreasonable rate increases. That failed. It started out with high favorability, but after the insurance industry and its allies got done with it, it went down in flames. So and in Colorado, you might remember some years ago, Colorado had a ballot initiative to establish a state-based single-payer system. Same thing happened.
I'm going to end with a brief observation, and then I'm going to turn it back to Hank to close. My observation is people want to be part of the winning team, and including people with a lot of money who could make a huge difference to our battle. They want to see that victory is within reach, and that's a catch-22, because it's the resources that they have that may get us to within sight of the finish line. So I think that's an ongoing battle. At the same time, the American healthcare system is in crisis, and that is well recognized now. I think more so than ever. We're totally going in the wrong direction, and businesses see that, donors see that. We need to translate that crisis into the opportunity to make real change. Thank you, Wendell, for putting up with my questions and the questions of all of our listeners. Back to you, Hank.
I want to thank everybody, including the audience, for a lot of really good questions. We didn't get a chance to put them all in front of Wendell, but we hope to bring you back, Wendell, and we'll continue.
Sure.
And, I know the night is young in California, but it's 11:18 in Philadelphia. So I think we ought to say goodnight. Again, thank you so much to you, Wendell, to Jim. And I want to thank Matt Petty for the tech support for running the webinar. And we'll try to troubleshoot what the problem was. I really want to commend the people that did get on. And we had almost 50 participants. So next time we'll have a little more practice with the tech side of things. So good night, everybody. Thanks so much. And come back in 2 months. Send any suggestions other than your demands for technical perfection, any other suggestions for webinar topics. And PNHP hopes to keep repeating these webinars with the help of our co-sponsors every several months. So we'll continue.
Just let me say, it's an honor to work with you all. Thanks for inviting me, and appreciate all the hard work you all do. And look forward to continuing to work with you all.